So I'm really excited to talk about the connection between obstructive sleep apnea and stroke syndromes. I am a stroke neurologist and a sleep medicine neurologist as well. And so naturally, I've been really interested in the overlap between the two. There has been a considerable amount of research and the literature that connects the two kind of in a bi-directional way. So we have an abundance of literature showing that obstructive sleep apnea is an independent risk factor for stroke, and the other way around, where strokes actually increase your risk of having certain type of sleep disorder breathings post-stroke. It's estimated that 60 to 70% of stroke victims have sleep apnea, much of which remains undiagnosed. And so my emphasis in the talk will be speaking not only to stroke neurologists, but general neurologists and other neurologists who handle post-stroke management and preventative care in terms of reliable and practical screening methods to identify patients who have risk factors for stroke, including hypertension, diabetes, hyperlipidemia, family history, advanced age, and obstructive sleep apnea. It's a work in progress in terms of what we know about the direct impact of sleep apnea and stroke. There's a lot of proposed pathophysiological mechanisms, including the hypoxemia leading to sympathetic overdrive, especially at night, which subsequently leads to increase in blood pressure and heart rate, reopening of the PFO, which leads to embolic phenomena, hypercoagulable states, increased inflammatory markers, and also sleep apnea accelerating carotid atherosclerosis and even other large vessel atherosclerotic diseases. Most notably, the clinical trial that will be highlighted during my talk and in other lectures during the AN will focus on an ongoing clinical trial out of the University of Michigan, led by Ron Shervin and Devin Brown, and that is entitled Sleep Smart. And it's really not only screening inpatient acute stroke and TIA patients, but also treating them in the inpatient stroke service. So I'm very excited to feature that clinical trial, which we're a part of here as a clinical site at the University of Arizona in Phoenix, and also to highlight importance of further clinical trials similar to Sleep Smart.